Hi everyone, I studied the rise of healthcare consumerism and the impact this is having on hospital marketing. The American healthcare industry is experiencing enormous change, resulting in a new era of healthcare consumerism. The catalyst for this new era was the passage of the Patient Protection and Affordable Care Act, otherwise known as Obamacare. It was enacted to lower the rate of uninsured Americans, reduce healthcare costs for individuals as well as the government, and improve the quality of healthcare. It's important to define healthcare consumerism and why it's important to hospitals. There are many contributing factors, including Obamacare, that have led to a smarter, savvier healthcare consumer. Patients are bearing a much greater burden of the financial cost of their healthcare, which is naturally leading to a demand for more information so that consumers are able to make informed decisions about where they spend their healthcare dollars. The uninsured rate is steadily dropping every year. The newly insured are now in a position to take responsibility for their own health. Because Americans are bearing a greater financial burden, they're demanding uncomplicated cost transparency. The Affordable Care Act mandated that hospitals publicize a list of their hospital charges for fair consumer decision-making. The Centers for Medicare and Medicaid Services, also known as CMS, launched the website Hospital Compare in 2005. The website provides consumers free and easy access to various hospital quality data like whether or not patients received antibiotics 1 hour prior to surgery, outcomes data like how many heart attack patients died at a hospital, and patient satisfaction data like how many patients felt they always had good communication with their nurses. With the introduction of value-based purchasing in 2012, it became mandatory for hospitals to report their quality and patient satisfaction data. The driving rationale for the program is the desire of CMS to improve healthcare by moving away from incentivizing hospitals to produce more volume and begin rewarding them for improved quality of care via higher reimbursements. All of this information is available for free for more than 3,000 American hospitals. This has been a cause for some concern as critics believe that consumers may not have the capability to understand the complexities of healthcare quality. The practice of hospital advertising was actually deemed undignified and was banned until the late 20th century. When hospitals did begin advertising, they primarily focused on marketing particular hospital features, touting the benefits of convenience, friendliness, and cleanliness. Even with the availability of publicly reported data, hospitals still don't typically market these metrics directly to consumers. Instead, they lean on the advertisement of awards that are based on these metrics. One such award is given by HealthGrades, a ratings website similar to Yelp, where patients can provide an online review of a doctor or hospital. However, the rights to advertise these awards can be expensive. A New York hospital reports being charged $145,000 just to use the HealthGrades logo on their website. And hospitals question whether or not the methodology to give these awards is objective and complete. Hospitals become frustrated when they're labeled a top 100 by one organization but rated 3 stars by another. Despite these frustrations, research shows that consumers are finding this information and tend to trust online reviews. So the question my research seeks to answer is whether or not patients care about this information. Do they really want to know the gory details of quality measures? And if they do care about this information, then are we leading consumers to the data effectively? How do hospital marketers relay their high quality in consumer-friendly terms? My survey results were certainly indicative of a typical American consumer and one that's likely bearing a much greater healthcare cost burden than ever before. Interestingly, right on par with the nationally uninsured rate of 11.9%, of my 599 participants, 12% were uninsured. Through my research, I learned that the majority of respondents have never even heard of the website Hospital Compare, and more than half were unaware that publicly reported healthcare data is available for free. Yet participants do feel that a hospital's reputation for quality and patient satisfaction are significantly important. Participants were significantly likely to search for hospital quality and patient satisfaction data if they needed treatment, and 54% said they've actually actively looked for this information. Yet of those who have actively looked, only about a third knew where to look. To understand who consumers would trust as a source of hospital quality and patient satisfaction data, I asked participants to rate their trust in a hospital's website, a health insurer's website, CMS, a site like Yelp, and their personal physician. Less than half trusted a hospital with their own data. A site like Yelp ranked pretty high, and the Center for Medicare and Medicaid Services was almost in the lead. Not surprisingly, consumers trust their doctor the most, and trust in physicians is significantly greater than any healthcare advice ever found on the internet. Naturally, doctors have the advantage of a personal physician-patient relationship that can actually mature over time. So what does all this mean for marketing? Well, first, all this rising consumerism is naturally leading to the need to differentiate from the competition. And two, quality and patient satisfaction are clearly important to consumers who have a right to this information so they can make educated healthcare choices. Hospitals are faced with not only a need to improve their patient outcomes, but they must find effective ways to communicate with savvy, smarter healthcare consumers. The government is challenged with improving their advertising efforts to inform consumers of Hospital Compare. Hospital leadership should partner with award rating sites like Healthgrades to ensure their data is aggregated objectively and accurately. I recommend that the American Hospital Association get involved as a key developer of the methodology. With the incredibly high trust patients have in their physicians, hospitals must aggressively employ relationship marketing strategies to strategically align with key physicians. And finally, hospitals should certainly continue to purchase the rights to display their quality awards like Healthgrades, which are highly utilized and trusted by consumers. Thank you for your time, and I look forward to your feedback.